Hi, my name is Dr. John Ferrari. I'm a general practicing dentist in Montville, New Jersey. Been practicing there for over 33 years, and our practice specializes in cosmetic and mini implant dentistry. Yes, we participate in many dental insurances. The best way to find out is to give our office a call, and Kathy can call the insurance and find out what your benefits are and if we participate. Yes, we offer an in-office savings program that includes 2 cleanings, all x-rays, emergency exams, and entitles the patient to a 15% discount off of all procedures. A dental implant is basically a titanium post that is placed through the gum into the bone and can either secure a denture, a partial denture, or a permanent crown. The reason why someone would want to choose a mini implant over a conventional implant is because mini implants are, first, they're less costly than conventional implants. They heal much faster than regular implants. We don't need to drill as big an osteotomy site for the implant, and we can restore them much quicker than you can a conventional implant. An ideal candidate for a dental implant would be somebody who has a loose-fitting denture and wants the denture secured, or is missing teeth and would like to have the teeth replaced. No one is ever too old to have a dental implant done. I placed them on people as young as 16 and as old as 85. If someone's missing multiple teeth, the 2 options would be either to have a removable implant retained denture made or replace the missing teeth with mini dental implants. If someone's missing a single missing tooth, the best option is going to be to have a dental implant placed. And the reason for that is the implant will keep the bone from resorbing away. If you don't have enough bone for a conventional implant, most of the time you would have enough bone for a mini implant. But we still need to evaluate you by taking a special x-ray to make sure there's enough bone for the mini implant. To have an implant placed, it's a very simple process. You come to the office for a free consultation. We'll take a special x-ray to show us the amount of bone that you have, and then we take an impression and have a special stent made to guide where the implant's going to be placed. You then come back 2 to 3 weeks later, and the implant will be placed and be restored a few weeks after that. The procedure for having an implant placed is virtually pain-free. We numb the area, and I haven't had anybody complain about feeling any pain during the procedure. Most dental insurances do not cover the placement of the implant, but they will cover the placement of the crown or the denture. Yes, depending upon the case, there are some cases where there is enough bone to place the implant the same day of the extraction. The cost of a dental implant really has a lot of factors involved. A lot of the insurances we participate with will also have a certain fee attached to it, and also the type of implant, mini implant we place, could have a different fee. The best way to find out is to come in for a free consultation, and we could let you know exactly what the price would be and if you're a candidate for it. A porcelain veneer is almost like a fingernail. It goes over the outside and the edge of a tooth. They're very thin and they're just bonded on, and they can change the look, the color, and the shape of the tooth. A dental veneer can correct minor crowding of the teeth, sort of like an instant orthodontics. Also to whiten the teeth, a permanent whitening, and change the shape of the teeth if needed. Porcelain veneers can last for many, many years. I have patients that have them for over 20 years. Bridges actually replace missing teeth, and they're made out of a very strong porcelain called zirconia. Clear aligners are an orthodontic procedure that involves the patient wearing clear trays, usually one every week or two, and the teeth are slowly moved into position. Root canal therapy is something that we perform when there's an infection in a tooth or when there's deep decay and the decay goes basically into the nerve of the tooth. We remove the nerve and we get the tooth ready to be restored with a crown. So if somebody has a floating or a loose denture, the best thing would be to have mini implants placed to secure the denture. The alternative to Invisalign would be to use something called an Inman aligner, which is sort of like a retainer that can move the teeth in certain situations. We're able to use that instead of Invisalign. Somebody that has a large filling in a tooth the tooth has been weakened by the size of the filling is most likely a good candidate to have the tooth crowned, or if there's a lot of decay in a tooth and there's not enough tooth structure left to place a filling. Yes, we offer emergency dentistry for somebody that has a toothache, has pain, or has a cosmetic embarrassment with a broken front tooth. A dental emergency would be anybody that calls with pain or a toothache or a cosmetic embarrassment where they break their front tooth. Something like that would be a dental emergency, and we always get them in right away, same day. If somebody has bleeding gums, the best thing they can do is to call our office, because gum disease could also affect the rest of your body, diabetes, heart disease, and other ailments. We have two options for whitening. We have an in-office whitening that works really, really well. Kathy does the whitening. We're getting excellent results with that. We also have whitening home kits that you can purchase. Depending upon the health of their gums, for someone with healthy gums, I would recommend come to the dentist every 6 months. If somebody has bleeding gums, they need to go to the dentist every 3 to 4 months. I definitely recommend electric toothbrushes. The Sonicare is the one we recommend most. I also recommend water picks. The combination of the Sonicare and a water pick, along with flossing, would be all that you would need to keep your mouth healthy and clean.